Deep vein thrombosis. It is also known as DVT, and it is a blood clot that is formed in a deep vein, and it occurs in the leg, thigh, pelvis, and arm. If the blood clot is in the leg, the area will become very swollen, hot to touch, and it will be very painful. Its reduced blood flow in the veins is a significant contributor to a DVT formation. Certain medical conditions or medications can lead to an increased tendency for blood clotting. Thrombophilia and factor V is an inherited disease. Artificial intelligence is used to help with analyzing a DVT. It's a software that assists radiologists in interpreting imaging studies, and it also works with the various modalities like ultrasounds and MRI scans. It will highlight the area of concern for the physicians to be able to see if there is an actual DVT. It improves accuracy and efficiency of the image interpretation, and it also is a faster way of diagnosing and getting the patient the treatment that they need. The people that would be at risk of developing a DVT is people that have cancer, autoimmune disorders, inflammatory bowel disease. Also, obesity. Obesity can be a big risk of DVT due to the association of venous stasis and inflammation. Smoking also is a big contributor to causing a DVT. It damages blood vessels and promotes inflammation. Pregnancy and postpartum will lead to changes in the blood composition and increased pressure on the pelvic veins, which can cause and might develop a DVT. Age is a big risk factor. Usually people that are older, they will also go ahead and age in the blood vessels, and that just helps to compromise the veins. Physical trauma also has fractures. Muscle injury can lead to DVTs due to damage of the blood vessels. Immobility associated with recovery of surgery also can cause DVT to happen, especially because the person is immobile and is not ambulating. These are statistics. It shows the number of people that are affected per year, which is 900,000, deaths per year, which are 60,000 to 100,000. Sudden deaths is 25%. A sudden death is the first symptom about maybe 1.25% of the people who have a pulmonary embolism. Long-term complications can be about 33%, and that is among people who have had a DVT. 1/3 to 1.5 will have a long-term complication. Now, here's an image that shows usually where a DVT can occur, and that's behind the leg. And there's an image there that shows a normal blood flow. Then it shows a deep vein thrombosis, how the blood is starting to clot in that area. And then the embolus, where it shows that the blood clot is dislodged. Here is another anatomy picture where it shows a pulmonary embolism. This will show how the clot will travel into the lung. Once it's there, it will dislodge from the thigh, of course, that's how it gets into the lung area. The clot will travel to the heart, and the heart will pump it out, and it will result in a pulmonary embolism. This can cause chest pain, difficulty breathing. You will also experience coughing and even coughing up of blood, and it will cause an irregular heartbeat as well. DVT disrupts the normal physiology and it impedes the blood flow. It promotes inflammation, coagulation, and potentially will lead to severe localized or systemic complications. Early detection of a DVT is very important, and it is important to address it as soon as possible to be able to get the right treatment for this. It will obstruct the normal blood flow, and it will affect and build up pressure within the affected vein and disrupts the normal circulation of the blood that will go back to the heart. This will also create a lot of pain, tenderness, some cramping, some soreness sensation in the area, especially in the leg area. The pain may occur typically in the calf and the thigh, and it will range, the severity of pain can be from mild to severe. Swelling or edema also is known to happen, and that's one of the symptoms of a DVT. The skin also will appear to be reddish. It'll be hot to touch. It might become swollen as well. Inflammation will be increased, and there will also be some pressure in the affected area because the vein is affected. This can lead to increased permeability and permeability of the nearby capillaries. This also will increase some fluid and proteins that will leak out of the bloodstream into the surrounding tissues, and this will cause the swelling and tissue damage as well. An impaired blood flow resulting from a TBD can lead to reduced oxygen delivery to tissues supplied by the affected vein. So this can also cause for tissue hypoxia to happen. And with more further inflammation and of course with tissue damage because the circulation is not flowing to the area that needs to be. Long-term consequences, it's a pulmonary embolism, post-traumatic syndrome, which is excruciating pain to the area where there was a blood clot, chronic venous insufficiency. There is also a risk of recurrent blood clots, especially if a person has had a history of a blood clot in the past or even has family history of a blood clot in the past. It's a very rare case. This is severe cases where there could be a venous ulcer, which is caused by a blockage, caused by a blood clot, and it happens again to be severe cases. Another thing that could happen would be a pulmonary embolism, dislodging from the thigh, going into the heart. Again, going back to the slide that was showing the image of the heart, and it will eventually travel into the lung and can cause fatality. There's also pulmonary hypertension. This is caused by chronic blood clots that are in the pulmonary artery, and that is called a pulmonary emboli. Artificial intelligent models that will be used is duplex ultrasonography that helps with diagnosing a DVT. It's usually visualizes the deep veins of the legs to detect if there's any blood clots present. Doppler ultrasound can be used also to assess the blood flow of the vein and make sure that the blood flow is flowing the way it should. There's also a CT venography that will help with diagnosing a DVT and a pulmonary embolism, and also a CT pulmonary angiography that will also go ahead and help, especially if an ultrasound result is inconclusive. That's the route to be able to go. Side effects is risk of bleeding. Long-term use of anticoagulants will cause osteoporosis. Also, heparin-induced thrombocytopenia can also cause decreased platelet count. Some allergic reactions are skin and eventually, or it could be also anaphylactic. There is also hair loss that may occur, especially with people that are injecting heparin, bruising or hematomas due to the anticoagulants. And then anticoagulants can cause a drug interaction with other medications, altering the effectiveness or increasing the risk of side effects. And this could be prescribed or over-the-counter medications. These are my references, and thank you again. My presentation was on deep vein thrombosis, also known as DVT.